Prime Minister Boris Johnson is under pressure from Tory MPs to set out plans to ease COVID-19 restrictions and deliver a vision for living with the virus. When he visited his Uxbridge constituency on Monday, he said ministers will look at the science and then decide whether to cut the quarantine period to 5 days. On Sunday, the Education Secretary told Sky News cutting the isolation period would help reduce staff shortages in key areas.
I would obviously always defer to the scientific advice on this. It would certainly help mitigate some of the pressures on schools, on critical workforce and others.
Ministers are also under pressure over the vaccine mandate coming for frontline health workers. When the Health Secretary visited King's College Hospital in London on Friday, he was challenged by ICU consultant Dr. Steve James over the mandate. The chief executive of the hospital said he was concerned over whether he will have enough staff to provide for patients safely. He also told BBC that about 10% of his 14,000 staff were unvaccinated. From April, NHS staff in England who have face-to-face contact with patients will need to have been vaccinated against COVID. The former chairman of Britain's Vaccine Task Force also said mass vaccination against COVID-19 should come to an end. Clive Dick said mass testing and vaccination should be ended for all but the most vulnerable after the booster campaign is completed. He is calling for an overhaul of the current government strategy in the coming months, and COVID should instead be treated like flu or a heavy cold among younger people who have been fully jabbed. On Saturday, the UK's official COVID death toll passed 150,000. This figure includes those who have died within 28 days of testing positive for COVID-19. The Prime Minister said it was a terrible toll. Joy Duguid, NTD News.